Good morning all. I am Dr. JISS, Department of Oral Medicine and Radiology, Annoor Dental College and Hospital, and this session is on Genodermatosis. Coming to the introduction, Genodermatosis are hereditary or inherited skin diseases accompanied with various systemic manifestation of different altered enzyme function or due to genetic abnormalities. So what then genokeratosis is? These are the various genodermatosis, that is hereditary ectodermal dysplasia, white sponge nevus, hereditary benign intra-epithelial dysketosis, pachyonychia congenita, xeroderma pigmentosum, incontinentia pigmenti, keratosis follicularis, warty dyskeratoma, Peutz-Jeghers syndrome, Ehlers-Danlos syndrome, tuberous sclerosis, and epidermolysis bullosa. Coming to hereditary ectodermal dysplasia, the ectodermal dysplasias comprises a large heterogeneous group of inherited disorders that are defined by the primary defect in the development of two or more tissues from the embryological derivatives of ectoderm. It could be a skin, it could be the hair follicle, it could be the tooth, and it could be the salivary glands. The various etiology include mutation or deletion of the gene in any chromosome, inherited genetic defect, de novo mutation, connexin defects. Genetics include hypohydrotic ectodermal dysplasia is characterized by defect in chromosome X, long arm 12-13.1. It encodes for a protein ectodysplasin, which is X-linked. And hydrotic ectodermal dysplasia, chromosome 13 is in a defect, and there is connexin defect as well as it is an autosomal dominant disorder. Hypohydrotic ectodermal dysplasia is otherwise known as Christ-Simons-Torreyne syndrome, which is most common among the two, and it is characterized by hypotrichosis, hypodontia, hypohidrosis, and onychodysplasia. There is typical facies that you can see like frontal bossing, sunken cheek, saddle nose, thick everted lip, wrinkled hyperpigmented skin around the eye, and low set ears. Oral manifestation include anodontia, oligodontia, peg-shaped teeth, delayed eruption, cleft palate, xerostomia, rhinitis, pharyngitis can also be seen. Coming to hydrotic ectodermal dysplasia, it's also known as Clouston syndrome. It's an autosomal dominant disorder where GJB6 is the causative gene which encodes for connexin chromosome 13q. No dental defects can be seen here, but there is nail dystrophy, palmar-plantar dysketosis, and hair defects can also be seen. This is the histopathology of hereditary ectodermal dysplasia. Coming to the white sponge nevus. It's also known as familial white-folded dysplasia of mucous membrane, white-folded gingivostomatitis, oral epithelial nevus, congenital leukokeratosis, and Cannon disease. It's described by Cannon in 1935. There is a defect in epithelial maturation involving tonofilament formation with impaired normal formation of superficial cells, and there is a defect in keratin 4, keratin 13, and it is an autosomal dominant disorder. Clinical features include it usually seen in children and can present at birth, become intense at puberty, there is no gender prediction. Site involves buccal mucosa, floor of the mouth, palate, gingiva, and other mucous membrane. The appearance can be thickened and white, folded, corrugated, spongy appearance with peculiar white or pearlescent hue. It extends from small patch to large area, and it gives a soft through furrowed or wrinkled appearance. On histopathology, you can see extensive keratosis or basket weave appearance. Differential diagnosis include leukedema, leukoplakia, lichen planus, and frictional keratosis. This is a chart which gives a differential diagnosis of leukoplakia, lichen planus, white sponge nevus, leukedema, frictional keratosis, tobacco pouch keratosis, and sheep bite. Coming to hereditary benign intra-epithelial dysketosis or HBID. It's otherwise known as Witkop-von Salman syndrome. That is characterized by defect in keratinization of cytoplasmic accumulation of tonofilaments with loss of cellular interdigitations and desmosome. Defect is in 4q35 points. And clinical features include it is usually seen in children with no gender predilection, photophobia and blindness can be seen. There is superficial gelatinous plaques on bulbar conjunctiva, white spongy macerated lesions of buccal mucosa with or without fold, angle of mouth, soft plaques with pinpoint elevations when mucosa is stretched. You can see round waxy appearing eosinophilic cells resembling minute epithelial pores called Dysketotic cells in histopathology. Coming to Pachyonychia congenita, it's otherwise known as Jadowson-Lewandowski syndrome, Jackson-Lowler syndrome, polykeratosis congenita. Here, the defect is in chromosome number 17. It's an autosomal dominant disorder characterized by mutation in genes encoding epidermal keratinocyte keratins K6A, K6B, K16, and K17. It is seen shortly after birth. There is no gender predilection. Thickening of nails towards pre-border with nail bed becoming filled with yellowish keratotic debris causing nail to project upward. There is sparse hair, corneal dysketosis, bulle formation in feet with crippling deformity. Oral manifestation include thickening of oral mucosa like leukoplakia-like lesion, angular chelosis, and frequent ulceration of the nasal teeth. On histopathology, you can see hyperkeratosis and ectodermal. Coming to Dysketosis congenita, it's otherwise known as Simpson-Engman-Paul syndrome. It's a genodermatosis, X-linked recessive inheritance, mutation in DKC1 gene which will cause disruption in maintenance of telomerase, which is critical in determining the normal cellular longevity. Features include cutaneous reticulated hyperpigmentation, nail dystrophy, pre-malignant oral leukoplakia, progressive pancytopenia. High incidence of oral cancer can be seen in this type of disease. Clinical features include it can be seen during first 10 years of life. There is male predilection with a ratio of 10:1, and first manifestation include dystrophy and shedding of nails after 5 years of age. Pigmentation can be seen in the trunk, neck, and thigh. Atrophic telangiectatic reddened skin can be seen with progressive pancytopenia. Oral manifestation include diffusely distributed vesicles and ulcerations with recurrent ulcerations, leukoplakia, and the atrophy of the tongue. Head-rounded bone loss can also be seen in X-ray. Coming to xeroderma pigmentosa, it's an autosomal recessive inheritance with defect in DNA repair system. There is increased tendency to sunburn, freckled pigmentation, and patchy depigmentation. These type of children are known as children of night because they can't be outside in the sunlight, because in sunlight the repair cannot be happening because of the DNA repair gene absent. Incontinentia pigmentosa. It's otherwise known as Bloch-Sulzberger syndrome. It's an X-linked dominant inheritance. There is neurologic, ophthalmologic, dental, cutaneous manifestation can be seen. There is tissue mosaic happening over there. It is seen shortly after birth, exclusively for female gender. There are 4 stages: vesicular stage, verrucous stage, hyperpigmentation stage, atrophy, and depigmentation stage. Oral manifestation include delayed tooth eruption, peg-shaped crowns, congenitally missing teeth, and additional cuts. You can see incontinence, meaning melanin incontinence in the connective tissue. Heavy melanin pigmentation of epithelium dropping down into clusters of chromatophores in the upper dermis. This is the melanin incontinence. Coming to keratosis follicular, it's also known as diarrhea disease, diarrhea white disease. It's also an autosomal dominant trait where there is lack of cohesion among surface epithelial cells. Gene ATP2A2 is affected with defect in 12q23.24.1 chromosome. You can see this in childhood or adolescence with equal sex distribution. You can see this in forehead, scalp, neck, and shoulders. Cutaneous lesions involve firm papules, grayish-brown ulcerate crustaceans, skin fall lesions, coiles, verrucous, macerated, foul-smelling masses can be seen. Nail changes like splintering, fissuring, longitudinal streak, and subungual keratosis can also be seen. Oral manifestation include cobblestone appearances of the mucosa like whitish pebble-like papules on the oral mucosa. In histopathology, you can see cord storms and grains or cell-within-cell appearance. Its differential diagnosis is biostomatitis vegetans. You can see cobblestone appearances in buccal mucosa also. Coming to watery dyskeratoma, it's also known as isolated diarrheous disease, isolated dysketosis follicularis. It is pilosebaceous apparatus in origin. Region sex is all age males. Size, face, scalp, neck, and upper chest. Elevated nodules umbilicated with raised borders up to 1 cm. Purulent discharge and bleeding can be seen. Whitish nodules, mostly on alveolar ridge and palate, can be seen. Differential diagnosis involve keratoacanthoma, molluscum contagious. Peutz-Jeghers syndrome. It's otherwise known as hereditary intestinal polyposis syndrome. Autosomal dominant inheritance. There is mutation in LKB1 genome chromosome with 19p13.3 chromosome defect. Intestinal polyps can occur in the intestinal mucosa. Tuberous sclerosis can be seen. Pigmentations can be seen. Perioral pigmentation can also be seen. Ehlers-Danlos syndrome. It is otherwise known as cutis hyperelastica. You can see hyperelasticity of the skin, rupture of arteries, Rubberman syndrome, subcutaneous nodules, papracia scarring. There is defect in collagen synthesis. Oral manifestation include fragile mucosa and gingiva, Gorlin sign, TMJ hypermobility, pipestone and hyperplastic enamel. Tuberous sclerosis involved. It is otherwise known as Epaulier-Bourne-Wiley syndrome. There can be facial angiofibroma, shagreen patches, ash leaf spots, tuber lesions in CNS, cardiac rhabdomyoma, and angiomyolipoma. Oral manifestation include gingival fibroma, gingival enlargement, and enamel peeling. Epidermolysis bullosa. These type of children are known as butterfly wing children because of the thin skin they are having. There are different types: epidermolysis bullosa simplex, dystrophic dominant, dystrophic recessive, junctional epidermolysis bullosa, epidermolysis bullosa acquisita, autoimmune, all other hereditary. Defect in attachment mechanism of the epithelial cells. So, genodermatosis are the dermal disorders with genetic connection, and also genokeratosis are those genodermatosis having oral manifestation. So that's all about the genodermatosis. Thank you.